This video introduces Chapter 15 of OEC 6, Cardiovascular Emergencies, by reviewing the anatomy of the cardiovascular system. Some key terms we'll see are aorta, coronary arteries, and myocardium. Let's begin. Cardiovascular disease is the leading cause of death in the United States. It could include pathologic conditions of the heart and the blood vessels, but then also acute emergencies such as DVT and pulmonary embolism. Many cardiac emergencies occur in a pre-hospital setting and they're life-threatening, so it's important to respond quickly and appropriately. Let's review the anatomy and physiology. A simple way to think of the cardiovascular system is to think about the pump, the pipes, and the fluid. The cardiovascular system is responsible for providing oxygen and nutrients to the cells and then returning waste products from those cells in the blood. Blood is pumped by the left side of the heart through the arteries to all parts of the body. This begins with the largest artery in the body, the aorta. Arteries divide smaller and smaller into arterioles, and then at the finest level, capillaries with a high surface area allow for diffusion of oxygen into the tissues and diffusion out of cells into the bloodstream, waste products and carbon dioxide. Capillaries then are the bridge, the finest blood vessel with the most surface area between arterioles directionally away from the heart and venules directionally moving toward the heart. So the heart is this muscular organ just to the left of the sternum in the thorax. It's about the size of a closed fist, and it is contained within a pericardial sac. Right here we see the prefix peri, meaning around, and cardial, the heart. The pericardium is literally the sac around the heart. Let's look more closely. There are four chambers to the heart, right and left, top and bottom. The top chambers are the atrium. I remember this by saying it's very similar to when you walk into a building, you walk into the atrium. As blood moves into the heart, it moves into an atrium. Now that atrium is a primer pump for the lower chamber, which is the ventricle, and that could be from the right ventricle anatomically for the patient moving blood to the lungs, or it could be the left ventricle anatomically moving blood away to all parts of the body. Let's look in more detail. It is the patient's right side that accepts blood from the body as it returns from the vena cava into the right atrium. It will then move into the right ventricle before departing through the pulmonary artery for the lungs. Oxygenated blood then returns from the lungs into the left atrium, then through to the left ventricle before departing through the aorta to all parts of the body. The cardiac muscle is called the myocardium. Literally, we see myo as the prefix meaning muscular and cardium referring to heart, so it's heart muscle. And we have a cardiac conduction system that allows all four chambers to beat in an efficient manner. The efficiency depends on the four valves that connect the entrance to the atria and then between the atria and the ventricles. Opening and closing of these valves allows for a one-way flow of blood. That's the pump. Let's take a look at the pipes. When we consider the pipes, we have arteries and arterioles carrying blood away from the heart, veins and venules bringing blood back to the heart, and in each case we're talking just about a size difference from big to small or from big to small. And then the connecting piece are the smallest vessels, the capillaries, with their high surface area that allows for diffusion. The aorta is the largest artery in the body. It carries blood from the left ventricle through the entire body. The coronary arteries carry oxygen-rich blood to the heart muscle, and they're just found on the surface of the heart itself. They leave the aorta immediately above the heart. very nearby the departure from the left ventricle. Ascending from the heart, we have carotid arteries that we find in the neck, supplying blood to the brain. At about the level of the heart or just above, the subclavian arteries supply arms and branch later on into the brachial, radial, and ulnar branches. The abdominal aorta supplies blood through the thorax and especially in the abdomen, and then eventually through the femoral artery to the lower extremities. We can see in more detail here the femoral arteries branching into the tibial and peroneal arteries, and then an important place to take a pulse, the dorsalis pedis artery, is on top of the foot. This helps us determine CMS in a patient that has, for example, a lower leg injury. Major places that we can take a pulse correspond to the positions of these major arteries. We have the carotid artery in the neck, we have the femoral artery in the upper part of the leg, the brachial artery in the upper part of the arm, the radial artery where we most commonly take a pulse. The posterior tibial pulse is a useful CMS check along with the dorsalis pedis. Continuing with the discussion of the pipes, veins return oxygen-depleted blood back to the right atrium. Two major veins closest to the heart are the superior, meaning top, and inferior, meaning bottom, vena cava, which drain into the right atria. The superior vena cava returns blood from the head, arms, and chests. The inferior vena cava from the abdomen and the legs, the inferior part of the body. Blood will move from the right atria into the right ventricle and then to the lungs where CO2 is excreted and oxygen is taken in through the process of diffusion in that high surface area alveoli in the lungs. Blood returns to the left atrium and the cycle is repeated. To wrap up our discussion of cardiovascular anatomy, we can focus on the blood and the four main components: red blood cells, white blood cells, platelets, and plasma. Red blood cells carry oxygen to the body's cells because of the hemoglobin they're associated with. White blood cells are principally part of the body's immune system, and platelets are a component of blood that allow clots to form to stop bleeding. Plasma, the fourth component, is the liquid component of blood.